welcome to our garden.
So we're excited to have our garden and culinary wellness program because this is one of the key things that our patients over the years have asked us for. As registered dietitians, we've been able to survey and also do all of our consults and teaching education, and despite us showing them the fake food, they've asked for real food. So here's our garden, and we also have a teaching kitchen.
Here we're growing some peas. There are sugar snap and snow peas here. They're just, there's a lot of blooms right now, but the pods are still developing. Here we have radishes, spinach, and arugula. This is our worm composting container, and it actually doubles as a planter where you see all the leafy greens and herbs growing around it. But the way it works is staff here at South Campus saved me their fruit and vegetable scraps. And like here's somebody's Brussels sprouts and banana peels, tomatoes. And I put all those food scraps in there, and there are 1,000 red wiggler worms crawling around. They eat the food scraps, and then I can, they turn it into compost via their digestive tracts, and then I can take the compost that they've made for me out the bottom, and the worms stay inside. Along the fence lines we have fruit trees, like this is a pear tree that's in bloom right now, and there are lots of fruit trees growing down the edge, and some herbs, some culinary herbs, and like pollinator plants. But what we've really been working on is getting all the systems and infrastructure in place to allow our garden gates to open for all patients and community and neighbors to be able to enjoy the garden. So some things that we're working on in order to allow that to happen are, first and foremost, we're expecting a big construction project to happen in the garden very soon, where we're going to have a contractor install an ADA compliant ground cover. So that means like some pavers or decomposed granite, like a stable surface for wheelchairs and people of all physical capacities or ages to come spend time in the garden. Another thing we're working on is getting a shed, a storage shed, and tools and supplies to go in the storage shed. Some other things that we're working on is developing a plan for any kind of like first aid or medical situations that arise in the garden. We're just trying to be prepared for people of all ages and capacities and health conditions to come in here and enjoy the space, but also stay safe.